enter the room.
Okay. So, good morning. My name is Muluna. I'm one of the doctors here. Are you Jim?
Yes, I'm Jim.
Hello, Jim. Can I please confirm your name and full name and age, please?
I'm Jim Carter, and I'm 65.
Okay, Jim. So I can see from your notes that you were treated at our hospital 4 weeks back.
I was. In fact, I've come here for that. I want to lodge a complaint, doctor.
I can see that you're a little bit angry, but can you tell me, can you walk me through what happened?
Yes, I want to lodge a complaint against that doctor who gave me that medication for my foot infection. I mean, instead of treating my foot infection, it gave me diarrhea and abdominal pain. I mean, I'm not going to condone this. I want to make a complaint.
Okay, I'll help you with that, but first, so that I can understand what happened, can you please walk me through what happened from the start, from initially how your illness started and what was done for you?
Well, like you mentioned, I came here 4 weeks back, whatever is written in your notes. I had a
Yeah.
foot infection and they gave me some medicine for that, some antibiotic. And after I took that, I had such bad diarrhea. I had to be admitted in the hospital for 2 days. You understand, 2 days. I had to miss my work for it.
Yeah, that must have been difficult for you.
It certainly was. What are you going to do about it?
So we're going to. I need a little. I need to ask you a little bit more questions. After that, we can go to the solving your concerns. Okay?
Why do you need to ask me questions? Don't you already know everything? Don't you have it in your notes?
Yeah, there are things that I can see from my notes, but to understand your situation better, I need to ask you some more questions.
All right,
Will
sure.
that be all right? Okay.
Fine.
Okay. So, have you had any similar symptoms in the past?
No, nothing like that.
Do you have any allergies, any medical conditions?
I'm allergic to penicillin and I don't have any medical conditions.
Okay. So are there any serious medical illnesses that run in the family?
No, doctor.
How about any smoking, alcohol? Do you think, do you use anything like that?
No, I don't smoke or drink. I mean, how is that any relevant? I've come here to make a complaint and you're just diverting the whole issue.
No, we will get to that, but just bear with me for a few minutes, okay?
All right.
So after your treatment, how are you currently?
I'm fine now, but that's no reason to, play this down any much. I want to make
Yeah,
a complaint and I want to understand why I was given that medication which causes so much problems.
yeah. So the thing is, the doctor that saw you initially, that is the first line treatment that we give to patients that presented with your symptoms. So, but sometimes in some patients, these medications can have side effects. Were you told anything about these side effects initially?
No, absolutely not. I wasn't told about anything like this that would happen.
Okay, so that's a gap in our part, but we will communicate with the person that saw you initially, and we will sort this out. Okay, and after talking to him, he and having more idea about what happened, about your situation, we can go further and help you with your launching complaints.
Yes, definitely. I would want to launch a complaint. I mean, I don't know what you will do to this person. I want to make sure that this doesn't happen to anybody. It was very distressing for me.
Yeah, I can understand that it was distressing, but it is that you have to understand that he didn't do anything out of the protocols. This is the treatment protocols that we use in our hospital, and unfortunately, sometimes some patients develop these side effects due to the medications that we give.
So you give this medication to anybody who comes with a foot infection. How many people get this infection anyway?
So,
2 minutes remaining.
This infection can occur, for example, in some people who have some immunosuppressions and other chronic conditions, and also in people who take other medications that suppresses their immunity. And we do give these medications for patients that present like you.
All right, doctor. What are you going to do now? Now what's going to happen?
So now I'm going to talk to the person that treated you, and we're going to find out more about what happened, and if there is any gap in his part, we're going to launch a complaint if we find anything that was not correct on his part. And also will help you launch your complaints as well. But other than that, he will come and talk to you also, and he will explain to you what happened and help you understand the situation better.
All right, fine.
Okay, thank you. So, do you have any other concerns?
No, I just want to make sure that my complaint is heard.
Okay. So, if you have any new symptoms other than what you have currently, and if you have any fever, any new symptoms, make sure to come to us, okay?
Okay, I'm sure.
Okay.
Move on to the next station.
Good job, doctor.
Thank you.
I know angry patient situations are a little difficult. I mean, they will
Yeah,
usually.
yeah.
But I think you handled it very well. Good job.
Okay, okay, thank you.
Just a couple of things. You did ask
Yeah,
all the right questions. You did get to the bottom of why this has happened. But then sometimes, if they show their anger, saying that, why you asking me so many questions, just get to the point where I have to make a complaint. Just explain to them what you are doing. Explain to them your role. Just say that I do
okay,
have all these notes in front of me, but I just want to hear from you what happened on your side, you know, so that we are
yeah,
on the same page, so that I can understand what your situation is better from you. So once you
yeah,
explain the role, that kind of diffuses the situation a little.
okay,
So whenever they try to throw you off, that's one good way to get back in, right? Just keep reiterating what you're there for. And
okay,
a couple of things of, you could have mentioned the body to which you can make the complaint so that they are more aware. So our main objective is to make sure that they are aware of all the related body of making
yeah,
a complaint, like the patient liaison
the,
service, PALS.
yeah,
Just say that I'll make a referral on your behalf, and you
yeah,
can complaint. Your complaint would be a good feedback on how the hospital is functioning. And
yeah,
the things is the question on why does this happen often? It was actually a mistake that was made by the treating physician. So you can mention that we can review our hospital protocols to see how any important changes can be implemented so that this doesn't happen again. right?
Okay.
And it was actually the fault of the doctor because he didn't explain that this is a side effect, right?
Yeah.
So that is actually something that you're required to do. So be apologetic for that. Own
Okay.
up to the situation, saying that yes, this should have been done. I'm extremely sorry that this wasn't in your case. We will try to review our hospital protocol so that this doesn't happen again, right? And
Yeah.
since this is an adverse drug reaction, it's very important to document that so that it doesn't happen again,
Yeah.
right? So if
Yeah.
she's already allergic to penicillin, that
Yeah.
you understood, that was a good question because the first line, if you know, is flucloxacin. So it is in the
Yeah.
penicillin. So you can't be giving the first line. So say that since you are
Yeah.
allergic to penicillin, there are a fewer options of medications that you can be given.
That you can be given.
So we've given you this medication, which also has the side effect, right? And we would
Yeah.
make sure to document this in the future so that there would be extra caution if you were being given this again, right? So that would
Okay.
be way to say that this is how we will prevent this from not happening again, right?
Yeah.
And the consultation was pretty good. Our Dr. Umar, our examiner, is also ready, so he will be giving you the rest of the feedback. Thank you,
Okay.
Doc.
Thank you very much. Thank you.
Hello, doctor. That was really
Hi.
great,
Okay. Thank you.
doctor, and really summarized really well for you. Okay,
Yeah.
so I'll start off by data gathering. Okay.
Yeah.
First of all, doctor, whenever you enter the room, you started like, is it Jim? And then you ask
Yeah.
to confirm the full name. So I
Yeah.
think that it would be better to confirm the full name first. Like you could have said, is it Jim Carter? The patient would have said, yeah. And then you could have said, okay, is it okay for me to call you Jim? Like it seems, abrupt. Is it Jim? Can you confirm your full name for me? So this seems
Okay.
abrupt. So to make a good rapport, ask for the full name first, and then ask like what would they
Can I
like
call
me
you?
to like to be called? Okay?
Okay.
You had identified the patient. You asked for the reason why did they come. Your data gathering was on top. Okay, you did ask the whole every question. Okay, and
Okay.
I really liked about like how you managed the patient about to take about the timeline events. How did the abdominal pain start? Why did it like diarrhea, clindamycin? You also inquired about the severity, and you also
Mm.
asked about the resolution of symptoms. But there were two to three things that I would advise you. You
Okay.
should also ask about the patient, like, have they ever taken any other medication apart from clindamycin? You never know that they might have been taking any other medication for the pain or for diarrhea.
For
You never
this,
know.
for this illness, for the current illness, for the.
Yeah,
Okay. Yeah.
yeah.
Okay.
Okay. People are taking home remedies. You never know. So
Yeah.
it's just like you
Yeah.
need to play a safe doctor.
Yeah.
Okay. And you asked about the medication history, medical history, family history. So I think you also should have asked about the living situation. Like, how is he living? What does he do? How is he financially? Like, he
Yeah.
told you several times that he had to stay in the hospital for 2 days. So, how is he coping with it? He also told you that he needed to mention the like his employer that he had to stay in the hospital. So you should have asked him like, is he okay financially? Is he doing okay? Any stress? Like, such questions to just to make sure that you are communicating really well with the patient.
Okay.
Are you following me?
Yeah. Yeah.
Okay. So, two, three more things like I would really advise you to be more apologetic. Uh, you should have, mentioned such lines like, Jim, I understand that this must be really difficult for you. I can see that you are really angry. I can see that you're really, stressed out because of this. I'm really sorry. This should not have happened to anyone. I can understand. There's such questions to make some emotions and communication with the patient to make the patient feel more comfortable, like they have come to the right place, for the consultation. So you need to take the
Yeah.
step and you need to show that you are there for the patient, not just by telling how would you manage, also by showing your body language. Like, yeah, you really understand that what's really happening. Okay?
Yeah.
Okay. So, another thing, Jim also mentioned that he wants to file a complaint against a doctor, and you mentioned that you defended your colleague, you defended the other doctor. So I would really like to tell you that in such scenarios, you never defend and you never blame. Okay, you can't defend your colleague and you can't blame your colleague. So what you can do is that you can say that I understand that you are really stressed about it. Okay, uh, I will help you. I will show you the way how to file a complaint. I will inform my seniors. We will investigate at what really happened, and we will take actions on based on that investigation, and we will be transparent to you. We will be honest to you about the investigation as well. Okay, so you can't say that it was the fault of the doctor. You can't say it was not the fault of the doctor. You can't blame or defend. You can only say that you will help the patient to tell that how would they file the complaint, and you will involve seniors for investigation. Following me?
Yeah.
Okay. So in the management part, you explained the reason for prescribing clindamycin. It was good. You also explained the potential side effects. But I guess you could have been more apologetic in your body language, and you could have also told about preventative measures, like you would review the guidelines. So you need to tell them about the preventive measures, like you would inform your seniors. They would review the guidelines. They would ensure the patients are well informed about the medication. So I guess that you could have told about all the gym about the guidelines, ensuring that every patient is known about, well informed about the medications, informing every doctor that read the guidelines and know the protocols. You did well
Yeah.
offering the follow-up. You also did well offering the safety net, mentioning that if they ever feel any other complaint, they should come back. Your management was okay. Your data gathering was okay. Regarding your interpersonal skills, I would say that you could have been more apologetic, more empathic, more supportive. You could have been more
Okay.
understanding, like ensure the patient that you understand everything and you feel it. You
Yeah.
had you reassured the patient, but you could have also, involved the patient in making future decisions. Like, what
Mm.
do they want? They wanted to file a complaint. So, considering
Yeah.
that you were a GP, you are an FI2 in GP surgery. So, you could have also told
Mm.
about the GP practice manager. Like, you could advise
Yeah.
them to go to the GP practice manager, give your feedbacks. There's a license
Mm.
services. You can also give your feedback. GP and UK system takes such feedbacks really seriously. We will do a thorough
Yeah.
investigation and we will be straightforward to you. Like, you need to be more,
Mm.
communicative and more empathic towards the patient, considering that he has come here an angry patient. So you need to,
Mm.
calm his anger.
Okay.
Regarding data gathering, only a few points more. Like you did really well. I'm not criticizing. It's just that you could have done it more better. So
Okay.
you could have also asked the patient about eyes. Like, what
Uh,
do they have any idea, or what do they think that could have caused this abdominal pain and diarrhea? Or you could
yeah.
have also asked, are there any other concerns or are there any concerns regarding this? And you could have also asked about the effect on life. Like they told you that 4 weeks back they came to the GP surgery for a wound infection and now they have developed such several symptoms. So how are they
Mm.
coping with their life? I know that Jim already told you that they had to take, 2 day off and be hospitalized. So how are they
Mm.
coping with it? And Dr. Mullen, you always need to be a safe doctor. So
Yeah.
you did ask about the current symptoms, but it would have been better if you could have mentioned that, Jim, I would really like to examine you, checking your vitals such as heart rate and etc. etc. and also your foot to check if there's any
Okay.
infection and also your tummy, whether you have any
Yeah.
pain right now or not. So such things,
Mm.
make a good rapport with the patient.
Yeah.
Patient also understand that doctor is here to help me. Doctor is really trying to help me. So
Yeah.
you'll get very good marks than in interpersonal skills. So there are such,
Yeah.
such things that you could have done it better. But overall,
Mm.
it was a great scenario. And one more
Okay.
thing, I would really advise you to be more confident. Like
Okay.
you need to be more confident that, yeah, you are the doctor here. Even when you are being apologizing, you need to be confident, like in the way you speak, that you
Yeah.
are really here to help them. So don't be like submissive, be confident and be more empathic towards the patient.
Okay.
Any question or any question that you would like me to, repeat any point?
Yeah, just one question. Like in this case, for example, if uh, the previous doctor's only fault was that he didn't tell the patient about the side effects initially. Otherwise, he did the right thing. So uh, I want offering the GP practice manager because I didn't think that it was that much necessary in this case.
Yeah, I really understand your concerns, but the thing is, Dr. Mullen, you never know what really happened. Okay,
Yeah,
maybe the doctor mentioned those side effects and the patient forgot, or maybe he didn't. It was the doctor's fault. You never know. So it's always better to play safe. You
okay.
could just tell that you need to go to the GP practice manager and give your feedback, and we will investigate. Because
Yeah,
investigation
okay.
reveals every kind of stuff. So
Yeah,
being a safe doctor, you always need to refer it for feedbacks and to conduct a investigation and involve your seniors. It saves you, it saves the other person as well. And if it's
yeah.
the other person's fault, you will always review the guidelines and make it ensure that it never happens in the future.
Okay.
Uh, did you get my point?
Yeah, yeah, yeah. Thank you.
That's
Any
a
other
good.
question?
I'd
No,
like to
that's it.
add on a few points to that. So that was
Okay.
very well explained by Dr. Umar. I
Yeah,
want to reiterate the fact that when in the NHS scenario, we have a very low threshold for offering services like PALS and GP Manager because it's like a feedback service. So no matter if
yeah,
it's a if you even if you feel that it's not your fault or nobody in the hospital scenario was at fault, I mean
yeah.
his main problem was the infection and the distress, right? That is a known side effect, and
Yeah,
something as small as missing out to tell the patient that this is a possibility, it is possible. But as a feedback, since the patient had so much distress, how much one small mistake could have such big consequences can be better analyzed if all that information is gathered. So
yeah,
every scenario, whenever you have a chance to offer PALS or GP practice manager, you should have a very low threshold for doing that. I mean, that will also appease them, have somewhere to vent,
yeah,
right?
yeah.
So that would be a good practice.
Okay.
Otherwise, Dr. Umar gave a very detailed, very deep understanding into how the performance went. I just like to
Yeah,
add a few things. Um,
okay.
Towards the end, this is something that we tell everybody. But towards
Yeah,
the end, when you see that you have 2 minutes remaining, try to wrap
yeah.
up the station. And in the form of
Okay,
wrap up, three things you can always offer, which is
okay.
safety netting, which you did
Yeah,
offer towards the end. Like if you do feel any symptoms of the diarrhea or the foot infection, if you see any other symptoms like
yeah,
fever, worsening of your current symptoms that you've experienced, if you feel that, please do, seek medical advice. And the other thing is follow up. So since you know that this patient has made a complaint, you would want to hear about what has happened to that. So always
yeah,
arrange follow up where you can explain to them what has happened, after they have made the complaint. And finally, we have leaflets and pamphlets. So this is something that the NHS has printed for all kinds of scenarios. So offer them some information that they can read up about. They can understand better into the whole situation of what exactly are opportunistic infections like C.Diff, how are they caused, any reading material. This way the patient is also educated. That will be helping us, as well as you are also being safe on your side to make sure that if something in the conversation has been missed, we can always look into some reliable source. Yeah. All right. So that was the end of today's session. Thank you, everybody.
Okay, thank you very much.
Thank you very much. So we will be sending you a detailed feedback on all these points that we showed you, on what all are the missed and what all points you have covered, so that you'll be able to
Okay.
practice and help you practice. And apart from that, what we are conducting this exam or this mock is our own OSCE workbench. This is something that Dr. Rohit and I have created. We've put all the scenarios of PLAB 2 over here so that you have a structured way of practicing along with the timer. So, so this is something that you can use with anybody who's your practice partner or anybody who can understand English, because we have given a very detailed patient explanation on, the patient information on what the patient is, and alongside that we have a checklist on how the patient could mark you as the consultation is going.
Please like and subscribe to Turing Med School. Good luck with your preparation.